Welcome to the lecture series on vitamins and nutrition. Today we are going to look at different aspects of the disease, especially beriberi, different types of beriberi, the wet beriberi, dry beriberi and infantile beriberi and all kinds of diseases. And we are also going to look into some of the key components, the nutritive aspect of the food that would supplement for thiamine kind of deficiencies. So we are going to look into the technical aspects of how this particular disease is so prevalent, and especially we are going to look at the clinical aspects of beriberi. So we have seen earlier different aspects of the metabolic role of I would say thiamine, and how thiamine is extremely important in the decarboxylation reactions. And today we saw what exactly would be the major problem connected with, I would say, thiamine deficiency. So we know thiamine is such an important vitamin, and the deprivation of thiamine gives rise to this particular disease, what we call it as beriberi. Now in the previous class we were looking at wet beriberi, and we were actually looking at what are the complications that can result in wet beriberi. So we are going to look at the clinical symptom of wet beriberi. So this particular disease is actually characterized by these three important symptoms. Since it's a metabolic condition, a deprivation of energy, and heart being an important pumping organ needs constant supply of energy. So imagine heart is not able to pump energy because there is no sufficient flow of energy to the heart. So the heart tries to compensate by beating fast. So the heart muscles and heart as a whole tries to compensate for the loss. So there is tachycardia, what we call it like increased heart rate. Because of increased heart rate, and we find a low level of energy that leads to shortness of breath. So completely, I would say, the person would feel very much weak. And since heart there is tachycardia and shortness of breath, so you find the circulation of fluids across the body would result in swelling of legs. So that's what we saw, a typical symptom being pitting edema. Okay, so you see there in the shin region there would be a typical pitting edema. So pitting edema is like you press the finger and you see the depression over there. So it shows that all the fluids are being, I would say, extravasated. Okay, so it would move from the vasculature and move between the tissue spaces. So you see here in this condition you do have a version of beriberi, what we call it like Shoshin beriberi. So this is one type of wet beriberi, but in this beriberi the cardiovascular component is so acute, what we call it like acute fulminant cardiovascular beriberi. In other words, it's called Shoshin beriberi. So what is fulminant, acute fulminant? It's like all of a sudden and so rapid. Okay, so what happens here in this case, you may not find the classical symptoms of edema, but instead you have the symptom of cyanosis of hands and feet. So what is cyanosis? Cyanosis is the cells have been deprived of oxygen. So cells are deprived of oxygen, they are not in a position to like really, I would say, supply oxygen to every part of your body. So there would be more accumulation of carbon dioxide. Okay, so you have more of deoxygenated blood. It's not being replenished with oxygen. So that leads to cyanosis. So cyanosis is accompanied by tachycardia. So all the symptoms, you know, like distended neck vein, restlessness, anxiety, these are all, I would say, complementary symptoms, all relating to one common feature, that cells are not in a position to being subject to sufficient sources of energy, and moreover you can also consider they are not into kind of oxidative phosphorylation and other essential metabolic processes not happening in the cells. So you see that there is one more type of beriberi, what we call it like infantile beriberi. Okay, so this beriberi occurs at a very early stage, like 3 to 4 weeks, okay, hardly a month-old baby. So when they are, say, fed with the thiamine deficient mothers. So this is basically, these babies are being fed by mother who herself is deprived of thiamine, because milk is enriched with thiamine from the mother to the child. But suppose if there is a malnourished mother, she can actually pass on this deficiency to her kid, the newborn baby, and what will happen is the baby would suffer from heart failure, okay, and it would suffer from, the baby would be like motionless. It will be like in a semi-paralyzed state. There won't be any proper neurologic reflexes, and left like that, yes, that will create a permanent developmental conditions or abnormality, and eventually the death of the baby. Okay, so that's infantile beriberi. Now the other version is what we call it like dry beriberi. So what is this dry beriberi? So you see there, you find lots of changes. So one of the primary changes in dry beriberi is rapid loss of skeletal muscles. Okay, so the muscles lose their tenacity, like they're not able to like really move. Okay, the person cannot speak. They are not able to use their voice, like aphonia, no sound. Okay, they appear very kind of vague body pain. Okay, their wrists, they are not able to move. There would be dropping of all the essential skeletal muscles required for locomotion and movement is affected. And you also have the symptom, what we call it like paresthesia. Paresthesia is like abnormal tingling sensation and a localized numbness. Okay, so all this corresponds to some kind of neurodegenerative muscular changes happens. Okay, so if you look at it, this is what exactly we say. There is a kind of a overall tendency where the person is emaciated, not able to like really, I would say, focus and make any decisions, and the person is like completely bedridden, and a point comes where the person cannot even get up and walk. So here you have what we consider as peripheral neuritis. So what is peripheral neuritis? Inflammation of nerves in the periphery, so all connected with autonomic nervous system. So the person will have severe cramp kind of a symptom, because muscles are there but muscles are not being innervated or being properly directed. So there would be degenerative changes happening. So there will be muscle sore, and that's what would be felt as severe leg pain. It might look like a kind of a restless leg syndrome, but it's even more or worse than that. The person would eventually end up in paralysis. So you see, one more version of beriberi is what we call it like Wernicke-Korsakoff syndrome. It's also called cerebral beriberi. This is an extension of dry beriberi, where some of the regions in the brain get affected. Okay, so it affects cerebellum. So what is cerebellum? Cerebellum is that center in the brain which controls our posture. So our posture would be affected because cerebellum undergoes degenerative changes. So that's like immediately reflected by the person finding it very difficult to coordinate. Then we have medulla oblongata gets affected. Okay, the person's ability to regulate heart rate and breathing rate are completely affected. The person would like really run into a mode where he would be at risk for most of his conditions. Then you have brainstem. So in the brainstem you find lots of changes happening, and the person eventually feels as if he is not able to correlate or relate with other muscular activity. The will would be there, but the person will not be able to like really execute the muscles and perform complicated tasks. I mean, even the task of walking, coordinating, movement. So its daily routine as far as using his normal limbs would fail. So here we have a very typical condition. Eventually it leads to encephalopathy. So what is encephalopathy? So encephalopathy is encephal, they pronounce it that way as well. So it's like a kind of inflammation in the brain. Okay, so when not treated, it would give rise to a psychotic condition, completely altered personality. So who are more likely to suffer from this? Here we have alcoholics. We are going to see shortly how alcoholics are more prone for beriberi symptoms. So even now in this generation, when people are uncontrolled alcoholic abusers, they end up with the symptoms of beriberi. Okay, so you have some of the changes being mentioned over here. They show psychomotor slowing or apathy. So it's like their quick response to reflexes, everything gets affected. Nystagmus. Nystagmus is ability for the muscles to respond to light stimuli. Ataxia, like their posture is affected drastically. Okay, so you also have problems connected with ophthalmoplegia, difficulty for the eyes to accommodate to near vision and far vision. So their eyes gets like kind of hazy. Okay, so the person will not be able to think properly. So they will be like very much disoriented, and eventually the person will slip into a phase of coma and eventually would die. So that's what happened with most of the Japanese soldiers who were invading the neighboring highlands and mainland China during the Second World War, when they were stressed in the war, and a dietary deficiency of thiamine drastically made them, several of them die a miserable death. So you see over there, this is what exactly happens, what we call it like Korsakoff psychosis. So it's a kind of a psychotic condition, purely a dietary condition, because these conditions can be reversed. So there is a therapy. It's not like a kind of a brain tumor or any other disease where you do not have any kind of remedy for it, but this is a disease where you do have a remedy, and the remedy is very simple, a dietary supplementation of thiamine. So you see there, but I would say this kind of diseases like Korsakoff psychosis and many other diseases normally result because of a prolonged, I would say a deliberate lack of exposure to essentially vitamin rich food. Then they develop all sorts of complications. So it's like being documented very well, because in the early days people did not know how to treat this disease. So they were into wild speculations of how this disease is happening. Okay, so here we have the vernix area. Okay, so this is one particular area where there would be inflammatory changes happening. So that's why it's called vernix encephalopathy. Although we can treat, rehabilitate the person, once the damage is done, even after reversible therapy, reversible outcome of the therapy, the patient might still carry some difficulty because of degenerative changes. Because you know very well, anyone who has a degenerative changes in the brain finds it very difficult to recoup back into a phase of normalcy. Here is an example to tell you the significance of polished rice. So you see there in the quite left extreme you have the polished rice. Okay, a typical other extreme you have the unpolished rice. So unpolished rice has whole grain of rice, and you find over there in the middle category what we call it like germ and bran layer removed. So this is one particular layer which is removed. Always remember the cereals, they have the aileron grains. Okay, so these aileron grains present in the seeds are important in terms of retaining the thiamine. So when you polish them, the aileron layer gets slowly eroded, and a fully polished rice would actually be completely deprived of thiamine. Although taste wise, because this rice is like really, I would say, polished, taste wise this might be better, but health wise the middle one and the last one is better, because you keep intact most of the minerals available actually through unpolished rice or dietary sources. So even now we suffer from this particular condition because of pure negligence of information. So you see there whole wheat bread or whole grain rice or dry yeast, I would say grains, all these are excellent sources for thiamine. So that's one of the reason I have been telling you early. Probably people from the West did not show symptoms of, I would say, deficiency until they were like really exposed to this particular condition. So you see there what exactly would be the problem connected with alcoholism. Alcoholism actually puts a halt the way in which thiamine can be converted to TPP. That's the key. So you see that the thiamine in its form cannot be directly utilized by our system. So it has to be converted into TPP, what we call it like thiamine pyrophosphate or thiamine diphosphate. Now you find people who consume alcohol actually, I would say, prevents the vitamin B1 getting normally across the duodenum. So this is a fundamental problem, because alcohol could deprive even the entry of thiamine is something of serious note. Let's say, okay, the person is fine and he has let thiamine go inside his system, and where thiamine would be stored, being a water soluble vitamin, it cannot be stored in large quantities in organs and it would be quickly eliminated. So some of the reserves will last for a very brief period of time, and liver being the primary organ. Suppose if a person is already drunk, first problem is they are getting across vitamin B1 because of poor dietary habits. Then the second problem being they already start damaging the liver, because liver is that primary site of metabolism where you get rid of all kinds of substances that has to do or that could be a source of free radical. And but in this case, when a person is consuming alcohol, the functional liver region of the liver is also getting diminished. So suppose, let's say, for an healthy individual, if their liver is functioning 90%, for a typical alcoholic who regularly, would say, being addicted or probably dependent on alcohol, there would be a heavy load on the liver. The more the heavy load, the more scarring would be there, and it would become really difficult, okay, to treat the condition. So now you see alcohol, how it is deleterious. Even if you are going to take it, okay, across the duodenum, there you have a ban. You also have, I would say, the problem connected with the conversion, you have it. And the other problem what they face is basically fatty liver. So in this fatty liver, the functional region of the liver is being deprived. So this functional region of the liver deprived would also diminish the minimal storage ability of the liver to retain thiamine. So generally the storage is less, and you are also depriving the system of sufficient thiamine, and the person would really go into a state. So alcoholics in general are deprived of, I would say, thiamine over a period of time. So you see there the daily requirement would be 1 to 1.5 mg. So generally we don't need. If you are a person who is used to have a balanced diet, I would say you might be taking cereals, fruits, okay. You have substances like, I would say, connected with extracts of beef or liver, well balanced diet. So this well balanced diet, you find it very easy to supplement with thiamine. But there would be, I would say, cases where people who regularly being deprived of this particular diet would end up in, I would say, conditions. So the best way to retain the amount of thiamine would be to supplement the daily source of vitamin, or if a person has an unusual diet, it's always good to supplement them with the daily amount of 1 mg to 1.5 mg of thiamine. Now, apart from this disease, so this is a typical disease where it's completely, you can avoid it just with a dietary supplement, but once you let go the course of beriberi to form, then there would be a whole havoc of metabolic conditions happening. Now apart from this, thiamine is also being investigated. Yes, the thiamine deficiency I have shown you, and thiamine is also being used to, I would say, treat certain conditions like poor appetite. Then thiamine is also suggested as a remedy for ulcerative colitis. So ulcerative colitis is one condition where there is inflammation of the gastrointestinal tract, and the top layer of the gastrointestinal tract is completely deprived, and they end up in severe problems like diarrhea. Okay, so then we also have, I would say, diseases like AIDS, where there would be a fluctuation of immune responses and there would be a diminishing of immune responses over a period of time. So they say if you could regularly supplement with thiamine, you might improve the chances of prognosis. And again for people with heart diseases, and again for people with alcoholism, and aged people, the geriatric population, and people who already have a stress connected with cataracts where the lens becomes opaque, then glaucoma, the intraocular pressure is high, then people also who suffer from motion sickness. Let's say if they have to travel in a bus or a vehicle, immediately they start showing, I would say, variations. And again, people in spite of normal healthy diet, if you could take an extra dose of thiamine, you may have a question, do extra dose of thiamine is toxic? No, not, because any excess of water soluble vitamin would be like literally washed away by your renal structures. So that way it's going to be dangerous that if you're going to take more amount of thiamine, but the only word is if there is a deficiency, yes, we run into beriberi and all sorts of complications. So you see over there, it's also been recommended in the treatment or in the management of cervical cancers. So you see there cervical cancer and also in the progression of renal diseases in patients with type 2 diabetes. In all these cases, thiamine is being utilized as a drug of investigation. Also, although it's a kind of a vitamin, they say now since it's improving the symptoms, improving the outcome of the therapy, so it's been recommended for all these conditions. So you do have quite a lot of references, although I have not mentioned it here, and these list of references would help you to understand how thiamine is playing a very important role in the metabolism. Now finally, I am going to summarize today's session and finish off with the questions. So today's session we saw in detail about different deficiency conditions connected with beriberi, different types of beriberi we saw, okay, the wet beriberi, dry beriberi, infantile beriberi, then the encephalopathies associated with beriberi. Then we saw how a dietary supplement would actually be a good, I would say, advantage of providing a good start for attending to many of the conditions. And we also finished off with the therapeutic advantages of taking thiamine. Apart from treating thiamine deficiency, you can still supplement thiamine for many of its functions. And so with this we finish off with thiamine, a very important water soluble vitamin. So students, I recommend that you take down these questions. So what are the major deficiency conditions connected with thiamine? So this was a question in the previous session. As a continuation, I would say, what are the deficiency conditions that results in thiamine, and classify various types of beriberi, and mention the clinical problems connected with the management of beriberi, and what are the encephalopathy associated with thiamine deficiency. And finally, you also have a question you can take down, what are the advantages of thiamine supplementary therapy for treatment of other diseases and management of overall health of an individual. So thank you for your attention.